Good morning, everyone. Today we're very lucky to have Dr. Terence Tan from Haley Medical Aesthetics to talk about something new that we have heard about in social media, but we don't quite understand what it is all about. So, Doctor, can you tell me what is so special about this pen? What is so different about this medication?
This is the only injectable weight loss medication that's available. It has got an excellent safety profile. It comes in a pre-filled injection syringe like this, which is very easy to use. And we find that people using this product have very few side effects. At the same time, they get prolonged appetite suppression. And it's so far, although it's only been approved to be used for the last few months, most of the patients who have taken this love it.
I see. So when you say approved, it's approved by?
I mean, it's American, so it's US FDA approved. It's been used in America for many years for diabetes, but they found that the people who had diabetes who used this medication did lose weight, so they have actually adapted it and gotten approval to use liraglutide or Saxenda for weight loss.
I see. Okay, we had some questions on Facebook asking us about this medication. So if the patient is not overweight, can they still use Saxenda?
For a person to benefit health-wise from this, according to most guidelines, it will be better that the person is of BMI or body mass index of 30 and above or 27 and above with some form of chronic illness. However, using in an Asian population especially, we find that people with a slightly lower BMI are actually at slightly higher risk of chronic illnesses. For people with BMI between 23 to 27.5, they are already associated with slightly elevated risk of chronic illness, and people from 27.5 onwards are associated with high risk. So the verdict is still out there, whether this should be used for a certain BMI. One thing that we did find, it's only been approved in Singapore for maybe a few months, but what we find that this is good because it's able to suppress, it's a little bit longer acting than quite a lot of the other medications that we have. And patients, the early patients who have used this tell us that it's able to suppress these late night hunger pangs that they have.
I see. So you mentioned about other types of medication. So do I use this alone?
This is going to be pretty effective alone. Science has shown that people in general will lose about 10% of their body weight with this. But however, if that's not good enough, I'm sure within reasonable limits we can actually use other medications to help this work even better. But of course, I think a healthy lifestyle, a balanced diet, and lots of exercise is essential in anybody who wants to lose weight and to keep the weight off.
Dr. Terence Tan, we were reading up about Saxenda, and it says that we have to actually pair this with some diets or dietary requirements for it to be optimized. Can you share with us?
Yes, there are plenty of diets out there right now. We hear it all the time. So sometimes people come in, I think now the fad seems to be on the ketotic diet or the keto diet, and also the intermittent fasting diet. So a lot of people, they come in, they say, oh, I'm starting on these diets and it's really good. I've lost maybe about 2 kilos or 3 kilos so far. But after a while, if they come back and we ask them how is it going, they say, okay, it was good, but I couldn't take it for too long. I couldn't stand not eating my carbohydrate, taking too much fat. In terms of fasting, initially I had the willpower, but subsequently we couldn't sustain it. And I think that's congruent with a lot of the studies which have actually come about, in that a lot of these diets do work, diet or diet plus exercise regimes. However, sustainability is the key, and therefore we would still say for people who need it, please consider certain medications, but you should not forget about a good diet and good exercise. But we want it to be sustainable. Whatever diet you choose, please make sure that it's not overly severe. It's something that you can continue for the next few years, if not for the rest of your life.
So are there any side effects?
Saxenda probably has the lowest and the lowest incidence of side effects, and probably the best safety profile. Why is it so? Because some certain other medications have got certain stimulation effects, certain other medications has got certain risk factors, and this is actually pretty safe. Infrequently people do have some nausea, people do have some diarrhea or constipation or some gastrointestinal side effects, but by and large it's been really, really safe. There has been some talk about certain thyroid cancers. This is pretty rare. We're talking about maybe about 0.3% of the people, or 3 in 1,000 using Saxenda, versus 0.1% or 1 in 1,000 of people using a placebo or some form of saline injection.
Okay, what about the results? Is it long-lasting?
As with any medication, it is only effective when you use it, and therefore we should pair it up with a healthy lifestyle in terms of diet and exercise. Medical experts are feeling that obesity or being overweight is actually a chronic illness, and that there are certain innate potential within the body, whether it's within the fat cells or within the brain, that makes one a little bit bigger size and a little bit heavier than other people. And therefore, more and more us experts are saying maybe we should be finding safe and effective treatments and prolong it for a longer period of time. We are trying to look at how we can blend in safe medications with long-term treatment.
You see, so the weight loss when you inject it doesn't matter where you inject.
Yes, that's right. That's right. So it's a misconception that a lot of people have. It is similar to a natural compound or a natural molecule we have within our body called GLP-1, produced by the gut. It goes to our brain, namely our hypothalamus, to say, hey, please reduce your appetite, so our satiety increases, our hunger decreases, and that's how it works. And in a limited manner, it also works by reducing the emptying of the stomach, making you feel full after a meal for a slightly longer time.
Okay, so how often do we have to do this Saxenda injection, and for how long a period?
You have to do it every night, every morning. However, there are certain longer-acting analogues that I believe some scientists within the US is looking into. But for now, yes, you have to inject it every day.
Okay, that's great. So we have talked quite a lot about how the pen works and what it's all about. Maybe can you show us how it works, because people are curious, Yeah.
Certainly, no problem. You take off the cap and you see this is where the medication is. Swap the tip of the pen to make sure that it's nice and clean, and you put in the needle. Twist it in firmly but not too tightly, and remove the outer cap. Now, required dosage. For most people on a long-term basis, it will be 3 milligrams. Swap the area you want to inject. And for most people, that would be the tummy. So remove the inner cap, and then you see the needle. The needle is really small and thin. You inject yourself, push it in, and press this button until you hear the click stop. Leave it for maybe 1 or 2 more seconds for it to stabilize. You can then remove the needle by replacing the outer cap and twisting it out and putting the Saxenda cap back on.
Okay. Thank you, Dr. Terence Tan, for your insight today on the Saxenda injectable weight loss pen. And I think if any of our readers do have any more questions, they can just drop a question or just visit Dr. Terence Tan at Haley Medical Aesthetics and consult him about the new Saxenda weight loss pen.
Thank you.
Thank you, Dr. Terence Tan.
Thanks for having me.
Thank you.